to Health 360, where we're going to be telling you all about your health, fitness and wellness and much more. On the show this week, ostensibly harmless practice of holding your bladder could be costing you your health. Also on the show, we're going to be telling you how to sit right, how to walk right for the sake of your poor spine and all your organs. Dementia is not just manifesting itself in the form of memory loss. There are a host of other symptoms and signs that you must not ignore. We'll tell you about it. It's going to undoubtedly help you navigate better if your loved one is affected. That and much more up ahead on the show. I'm Sneha Mordani. This is Health 360. Desk job is ruining your health, your spine, your bladder, your digestion, your liver. There is no other way to put this. It is costing you your health. So what should you be doing? Quit? Well, of course not. What you should do is identify that there is a problem and help yourself. We can handle you. Yes, ma'am. Is this how you walk? Your head reaches your destination before the rest of your body. Is this how you sit? Curved shoulders, rounded, weak core, slouched when seated, resembling the letter C. Is this how you stand? Protruding stomach, tucked in hips. Ouch! Well, if this is how you get up, each time you get up with pain in your back, that remember that your posture and the way you sit is to be blamed. In fact, bad posture is not just related to basic discomfort like I showed you. It's also associated with a host of other problems. Like digestion, for example, can get affected. Of course, you'll develop perennial backache if you're sitting like that. Hey, what are you doing? What? What's with your position, your posture? It's terrible. What? Sit properly. I'm sitting properly only. Well, it's important. You're asking me if it's important or not, but it is very important. Let me tell you how and why. How many hours are you sitting in a day? 9 hours. Well, 9 hours is quite a lot. So sit properly. This is how you should be sitting. With your back against the backrest. There's the reason why there's a backrest and it's called a backrest. Not to do this. It impacts your digestion as well. You should know that. Also, your arms should be on the armrest. You keep your arms parallel. Ideally, it should be parallel to your spine. Okay. You know, your arm rest should be lifting your arms. It should not be like this. Look at you still. Also, when you're sitting, you should be sitting with your back pressed. So just sit with your back pressed. Listen to what I'm saying. Against the chair like that. Maintain a comfortable gap. Listen, you have to sit all day. Also, looking into your phone like this all day. What are you even trying to do? And certainly the way you're using your phone is absolutely wrong. Everyone uses the phone like that. Even this is not okay. Even this is not okay. Ideally this. Okay. Certainly not like this. At least this distance is fine. This is how you should be looking at your phone. Make sure you're not slouching. It's terrible. So just stop doing that. Prolonged sitting and wrong postures are not just wrecking your spine, but also your digestion. Plus, it has an impact on your liver. Non-alcoholic fatty liver disease is now being seen in young Indians, especially those engaged in sedentary occupations. A study conducted by the University of Hyderabad revealed that over 80% of its IT professionals suffer from metabolic dysfunction associated steer-tock liver disease or MASLD. 71% were classified as obese and 34% diagnosed with metabolic syndrome. These findings are concerning and the impact of sedentary work environment and unhealthy lifestyles on liver health. It also has a deep impact on your urinary health. Irregular exercise and bad posture over time can weaken pelvic floor muscles in the long run and further incline towards bladder control problems and pelvic organ prolapse, particularly in women. So, what's the solution? Indulge in frequent movement and posture exercises throughout the day to support pelvic positioning and bladder function. Pelvic floor exercises such as Kegels are especially beneficial for strengthening muscles that govern urination. Experts have noted how prolonged sitting is leading to varicose veins in younger individuals. Sitting is truly the new smoking. And joining us right now is Dr. Jitesh Mangwani, is robotic spine surgeon in Max Hospital. Thank you so much for your time. I want to ask you, desk jobs seem to be wrecking our back. Tell us, what are the kind of problems that one can expect if they're sitting all day pretty much, doctor?
Thank you. Thank you for the invite. Thank you for this wonderful question. So, desk jobs have been quietly and steadily damaging our spines. And as we know these days, most of the times we have at least 8 to 10 hours of sitting job, and we cannot
Right.
get away from the sitting job. So, this particular sitting basically slowly and steadily damages the spine. It is not something that happens acutely. So, slowly and steadily, that this sitting puts a excessive pressure on the ligaments, it puts the pressure on the muscles, which weaken over time, and also on the bones and the soft tissue structures around it. That is a disc.
Yes, but it's the most underrated problem. Wouldn't you agree that we kind of take our low back pain and our back pain in general for granted, doctor?
Yeah, I agree with that. And the reason for that is also the thought process. Because India being the tech giant these days, we have a lot of people who are in the young age now sitting, and the back pain issue that people had beyond 60 years. Now, these days, if you see the literature, that is between 20 to 45 years of age group,
Oh,
because
okay,
this is a
okay.
population that is sitting the maximum amount of time. And
Yes.
we dismiss most of the times, okay, this pain is just a small fatigue, this pain is just a sprain, when it is actually not.
Doctor, I want to ask you, poor posture is not just affecting our backs, it's also affecting our digestion. Tell us how.
Yes, in fact, madam, you would have heard one common phrase that all the doctors in this fraternity are saying, sitting is the new smoking. But
Yes,
this phase
absolutely.
is not just dramatic. This is having a well impact, and it is grounded in the medical truth and our histories. Why is it so?
That's right.
Because whenever we sit for a long time, the natural curves of the spine, so the spine is straight, it is not straight. So this is lost. Once that is lost, that puts a pressure overall on the abdominal organs also, which slows the digestion, constipation, causes the acid
Right.
reflux. It causes the impact on our cores and our glutes also, which overall makes the patient a risk factor for the obesity, diabetes, and heart diseases.
I want to ask you, nowadays ergonomic chairs are becoming very popular. What are they? Do they really help you?
Yes, ergonomic chairs are scientifically designed to help you because they help you to give a good support. They help you to give a good armrest. The backrest is good. But one thing is absolutely important. The ergonomic chair itself is not going to change. You will have to be
Right.
active with some form of general conditioning exercises even during the daytime, because this in together, the better ergonomic chair with a good lifestyle is going to
So
overall help
what are
you.
these exercises, doctor? If you could tell us about these exercises, since you mentioned,
So,
what are these
uh,
exercises that you can do to help
So there
ourselves?
are there are a lot of different types of exercises, but the most convenient type would be the aerobic general conditioning exercise, which would
Right.
be brisk walking. 30 to 40 minutes
Okay.
of brisk walking covering 3 to 4 kilometers is good enough. You can even do freestyle swimming and even aerobic exercises in the gym. But apart from that, I would say some micro movements through the day while you're working, take a break in every 30 minutes, walk around a bit, come back and sit. These small changes can also help a lot. So sitting is just like,
Absolutely.
sugar. A little is okay, but too much will start damaging the system. So we can
Well,
protect only via general conditioning exercises.
well, you rightly put that. Tell us, so essentially, we can out-exercise our desk job, isn't it? Because there needs to be a lot more focus on this right now. It's being called as a silent epidemic as well. Recently, a billionaire Gautam Adani called spine health, and the fact that it is ignored as a silent epidemic, a national crisis. Your take?
I was sitting in the audience when he gave this speech, and we heard it, and
Oh,
we actually celebrated this, because this
Okay.
is the way in which the awareness can be made. So I would thank respectable Gautam Adani ji to bringing light to this, because overall the prevalence of this problem is increasing, and also because of that the stress on the people financially to the system also has seen a gradual increase.
That's right. Back pain, again, like we've been speaking about, is a very neglected problem. Perhaps it's time now to identify and fix it. Thanking you, Dr. Jitesh.
Thank you.
Well, we all know, as our report has shown, that your desk job essentially is doing you a lot of harm. But one thing that is now being seen in younger people is that they're suddenly developing varicose veins. It's been seen because they're sitting for such a long time. Dr. V.S. Bedi is a vascular surgeon. He is now going to be telling us, doctor, about why younger people all of a sudden are now getting varicose veins, and what's this connection with sitting, prolonged sitting, doctor?
Yeah. So I think I'll explain it by a simple analogy out here. We have a
Yes.
heart basically which beats on its own. At the same time, when we talk about the legs, basically we have two peripheral hearts which are called the calf muscles of the body. The calf
Okay.
muscles of the
Okay.
body are what we call the peripheral hearts. Now,
Okay. Okay.
unfortunately, the peripheral hearts are the ones which basically, when you're doing activity, moving around, your calf muscles contract and they push the blood back into the heart.
Okay.
Now, these require, so that is why circulation of the calf is very, very important, that when you contract your leg muscles, the blood is basically going back into the circulation. The dirty blood basically goes to the heart, gets purified in the lungs. Now, if you
Okay.
do not perform this particular activity, you keep on sitting on your desk with a laptop and all for a very, very long time. What
Okay.
happens is these calf muscles which are there, the blood which is carrying in there, which is sitting in them, over a period of time, this blood keeps on getting collected. So the legs become heavier. And
Okay.
after some time, in fact, sometime in the later part of the day, you suddenly find that you develop some edema or swelling in the legs and all. That is
Okay.
basically because the peripheral hearts, we are not utilizing them, which we are supposed to use.
All right,
Yeah.
Dr. Bedi, I'm going to thank you for telling us about why just so many people are then ending up with varicose veins. It's not good. We all know that sitting for prolonged hours is something that has to be avoided. Time now to talk to our experts on very commonly asked questions around your health and wellness. Let's take a look. Well, you've heard of a heart attack. Who hasn't? But what about a leg attack? Now, leg pain is a symptom that is often dismissed as a normal part of aging or attributed to muscle strain. However, recent research has shed light on a concerning connection between leg pain and life-threatening cardiovascular events. This alarming correlation is known as the leg attack. Dr. V.S. Bedi, vascular surgeon from Delhi's Gangaram Hospital, is now joining us. Thank you so much for your time. We've come across this term called the leg attack. Explain to us, what is this leg attack and why is it connected to our heart?
Yeah. So I think a lot of people, or most of the people, I guess, they know what are the situation about the heart attack, which is basically when the blood vessels to your coronaries, the heart vessels and all get blocked. So similar kind of problem that we face in the legs is that if the blood supply to the legs goes off suddenly because of some blockages or some clots going down to the legs and all, the patient can get severe pain, and probably if untreated and all, within a few hours and all that sort of thing, the legs can become gangrenous. The patient can lose a leg also if they don't reach the hospital in time.
What's the connection really with, cardiac events? How does
Yes.
a symptom involving your legs,
Yeah.
say leg pain, have a cardiac health
Yes.
connection?
Now, what we say is that basically a leg is basically a mirror of the heart. So condition of the leg vessels is a mirror of the heart. Any patient who's got some blockages in the legs, the possibility of that patient having a cardiac condition is almost 25% to 40%.
Dr. Bedi, my last question to you has got to do with the symptoms around the peripheral heart disease. What are the symptoms
Yes.
that one should be watching out for? Like, I've turned 40. Should I
So,
be
yeah.
cautious?
So, no, at the age of 40 and all, generally we don't expect this disease unless and until, like I
Okay.
said, that you have a condition of the heart, or
Okay.
where, you have a lot of calcium in the blood vessels. When we do our cholesterol and all, if you're on the obese side, you're putting on too much
Okay.
weight and your activity is limited, you're not doing too much of activity, then in that case, there is a possibility that you could have these kind of situations. And that is why then you will manifest with certain symptoms, which I can elaborate once.
Okay, all right. We have that out for our viewers as well as far as the symptoms of peripheral heart disease, artery disease, I beg your pardon, is
Arterial
concerned.
disease.
This is
Yeah.
called PAD and
Yeah.
we call it the leg attack. Of course, Dr. Bedi has put the spotlight on what exactly is leg attack. I'm going to thank you, Dr. Bedi, for joining in.
Thank you. Thank you very much.
This is something that none of us can deny, can we? All of us have held our bladder. Well, ostensibly, this is harmless. But if you are doing it once a while, it is okay. But if you are not doing it once in a while and you've become habituated to holding your bladder, then you know that this is wrong. You are asking for serious trouble. We're examining how. Dr. Ashwin Malia, urologist from Delhi's Gangaram Hospital, is now joining us. Thank you for your time. Dr. Ashwin, holding your urine looks like looks like something which is not problematic, harmless, but it can lead to something as severe as kidney damage, isn't it?
Yeah, absolutely. See, holding your urine occasionally is okay. You don't have a proper bathroom nearby. That is okay. But making it a routine, making it a habit, especially we see this in shift workers like nurses, factory workers. So they will think that they'll finish their shift and pee later. But that's a big
Yes,
problem because it can lead to problems with the urinary bladder per se. The muscles can become weak. So the idea is to go and empty your bladder regularly without any, avoiding too much of delay. Otherwise, you're going to land up in a soup because of urinary tract infections, bladder stone formations. So all these problems can occur.
all right. I'm going to thank you, Dr. Malia, for joining us. So if you're holding your bladder for whatever reasons, avoid doing it, is what the experts are saying. How many of us have picked up vaping as a habit to do away with the habit of smoking? How many kids, young folks are starting to use vape? Well, it has become a gateway product. Vapes, supposed to be banned in India, are still freely available, undeterred. Take a look at how they are being sold easily. It's easily accessible even by school children. We're decoding the habit of vaping right here. Dr. Vineet Banga, neurologist from Fortis Hospital, is now joining us. Thank you so much for your time. I want to ask you, vaping is not just harming our lungs, it's interfering with cognitive functions in young adults is what is being seen. Does vape inflame the brain? What's the evidence?
Yes, it does inflame the brain, and
Yes.
it is almost not as harmful as nicotine, but it is not at all free from the side effects. So it causes inflammation and atherosclerotic changes in your brain, mainly the blood vessels, which leads to narrowing of the blood vessels, problem with proper oxygen supply in the brain, which leads to subsequent damage to the brain. And in
Right.
long-term use can lead to side effects such as stroke, dementia, and other issues.
Now, Dr. Sharad Joshi, pulmonologist, is now joining us. Thank you for your time. I want to ask you, vaping is stressing the heart out as well. Talk to us about why it is really as bad as smoking, and it's it's no better really in that sense.
The vaping is more dangerous actually. So what they thought that we will just put nicotine in it and we will reduce the content of tobacco. But actually what is happening is they are putting a lot of ingredients and fragrances and flavors in vape. So that people are getting addicted to nicotine as well as that particular fragrance or the flavor.
Okay. So nicotine is still there. Talk to us about those people who say that vape is an alternative to smoking then. We don't smoke, but we are vaping. What do you have to tell them, doctor?
So it's no better. Actually speaking, you are still addicted to nicotine, and nicotine is one content which is actually harming all the arteries and vessels inside your body. And that is how even the younger population is getting heart attack because of vaping.
Yeah, that's what we're talking about. A 21-year-old who very recently died of a heart attack. Family said no history of, smoking, but it was found that he was vaping from the age of 16. Let's tell you about another product that is supposed to be reducing harm. Well, at least that is how they are being marketed and sold. Nicotine pouches are small rectangular pouches filled with powdered nicotine, preservatives and other fillers for the flavor. Well, these pouches don't include tobacco leaves, so they aren't considered to be cancer-causing. Well, they're sold in varying strengths but typically have a higher concentration of nicotine. But should you be going for them? Doctor, I want to ask you about another, ostensibly something that, ostensibly reduces harm, which is nicotine pouches. Are these pouches that are becoming very popular safe?
Unfortunately, when they say that we have reduced the danger of smoking, we have. So what used to happen was that when a patient or a person was usually actually smoking a cigarette, he was inhaling 7,000 chemicals because of other content of tobacco and whatever was being burned or lit. But
Right.
when you talk about nicotine pouches or when you talk about vaping, you are still consuming nicotine. And nicotine is one thing
Okay.
which is not only harming your lungs or your, when you put the nicotine pouches in your mouth, it is actually
Right.
damaging your mucosa. So, risk
Okay.
of oral cancer is still there.
All right. So nicotine pouches clearly aren't something that you should be reaching out for. Certainly not vape, not nicotine pouches. Well, I think this is cold turkey. Going cold turkey on smoking is something that maybe doctors would recommend. Clearly, I'm going to thank you, Dr. Joshi, for joining in and sharing your thoughts with us. Monsoons have become synonymous with eye infections. Why is it so common during this season, and what can you do to help yourself? How often should you be getting an eye checkup done? An expert on the show is answering these questions. And joining us right now is Dr. Purendra Bhasin. He is an eye surgeon. Thank you for your time. I want to ask you, why is this that everyone seems to be developing an eye infection with the onset of the monsoon season, doctor? What is really going on here?
Thank you for inviting me, first of all. And monsoon season, always this invites a variety of infections in the eye. The reason is that the hot and humid, the environment is a very good culture medium for all these bacteria, fungi, and all these organisms to grow.
So
My
how does one
submission.
really keep it safe? I understand that eyes perhaps are one of the most important yet the most neglected organs, in our bodies. Essentially, we only go to an eye doctor when there is a problem. What's your
Yeah.
advice? What's your suggestion? Number one, on how to keeping our eyes safe, and then do answer my question on how important are regular eye checkups, doctor.
Okay. Firstly, you should not touch your eye. You should not rub your eye. Because when you touch your hand somewhere, anywhere, maybe in the common places, in the buses, in the platforms, in the train, or in the office, so you catch infections in your hands. So in your fingers, when you rub your eye, so you develop infection in your eye.
Okay, okay.
Secondly, if at all you develop these kind of infections, so you should go to the nearby surgeon, eye specialist, and ask for the antibiotic. If you go to the
Okay.
common the shopkeepers, they will suggest you to start steroids, which should be avoided in all these cases.
Nowadays, there are fairly common, eye drops in the market for these irritations in your eye. Are you saying that these medicines are to be avoided, doctor, over-the-counter medicines, and eye drops are to be avoided?
That should be avoided, strictly
Right.
avoided, because
Okay.
they mainly commonly they are having corticosteroids, which can lead to variety of adverse effects. So they should be prescribed only by the specialist.
I'm going to thank you, Dr. Bhasin, for joining in and
Yeah.
sharing your
Thank
views with
you.
us, sir.
Thank you.
Thank you. We often associate dementia with memory loss, but there is more to this disease than just losing your memory. Lack of empathy, paranoia, many other symptoms that are being associated with dementia now. We'll tell you what you can expect and look out for. Talking a little about dementia, what are the hidden behavioral signs of this problem, of this disease? How is, now that is being seen loss of empathy as sign? There's also a personality shift that maybe most people don't talk about, isn't it?
Yeah, and very important question, because when we think of dementia, we think only about forgetfulness, that you don't remember things.
Right.
But what we forget that is the brain also has other functions, which means the brain has functions with regards to emotions, whether you are happy or sad. Brain also works with judgment. A lot of judgment is important. So whenever a person has dementia, all the domains of the brain, the function that the brain does, get affected. And it is not only the memory, the emotional part of it also gets affected. So if you are the patient sometimes lose empathy altogether, they become emotionally blunt, emotionally silent. At times they become
Right.
aggressive as well. So, and this personality change, this empathy, loss of empathy, and problem with affect and mood is many a times overlooked. We just focus on the forgetfulness, while at the same time we ignore these small subtle changes which happen in
That's right.
patients' behavior and personality.
Including paranoia, isn't it, Dr. Banga? Mistrust. There is something that one is seeing in patients of dementia. Repetitive behavior is also something that's being seen in these patients.
Yes,
Why
a
do they
part of the
experience paranoia?
Yeah, so a part of the brain which is frontal lobe is important for the judgment, and that is why these patients have repetitive, perseverative behavior, and they keep repeating the same things. And your
Okay.
behavior also is controlled by the frontal lobe. So if the patients have problem with frontotemporal lobe, they tend to have more delusions, hallucinations, and more paranoia, and their paranoid behavior. They'll keep suspecting something or the other. So this is very common, and one of the dementia is frontotemporal dementia, which is especially has these symptoms more than Alzheimer's dementia, which is the most common type of dementia that we come across.
All right. I'm going to thank you, Dr. Vineet Banga, for talking to us and putting the light on such an important topic, dementia, and the hidden symptoms of which many of us perhaps overlook. Thanking you again.
Thank you so much. Thank you.
It brings us to the end of this edition of Health 360. We've put together all these stories for you. You can find them on our website, which is indiatoday.in. You can download the India Today app as well. You can also find them on our social media platforms like YouTube, Instagram, Twitter, or X, and of course, Facebook. Our hashtag is Health360, Health360 Plus. Do catch them, like, subscribe, and share. Do not forget. Thank you for watching. Take good care of yourself. Bye for now.